Good morning. I'm here just to give an overview over my poster. This is just a simple poster to highlight some research opportunities for our grad and undergrad students in the health professions. Um, so again, I'm presenting the All of Us Research Program platform. So the All of Us Research Program aims at recruiting 1 million, where I guess right now it's at 500,000 point. Again, subjects are recruited from all over the United States with an emphasis on, again, diverse population. Again, the subjects are being recruited nationally and going through essential basic surveys, blood work, and also they do sign if they are willing, they do sign an agreement to share their medical records, their EHR information. So again, you have surveys, you have EHR records, including diagnoses, lab values, X-rays, prescription history. Again, there are surveys on their health, their lifestyle. There's even Fitbit data. So again, there's a lot of data available, including genomic data. So again, there's core principles for the program, which is, again, participation is open for all. The participants should reflect the diversity of the population in the states, and again, participants are partners, so they take kind of part in decision making and research. And again, transparency is a must to kind of earn trust. So this program aims at gaining trust in research among minority populations in the US that don't usually like to participate. And again, data are accessible for research purposes and also with heightened security and privacy. Again, there's two opportunities for researchers. We have what's called the interactive data browser, and this is kind of publicly available on their website where you can get aggregate data. This type of data is suitable for undergrad students, even high school students, if you're engaged in programs that work with high school students because it does not require an agreement, and it does not require much of a training. And then we have the researcher workbench where you have to have a login and an access to access it. And this is very suitable for your grad students that are at that level of to formulate research questions and handle data. Again, the workbench requires a login, but also requires that the university that you are with have a JURA agreement, a data use research agreement. Once university has a data use research agreement, which most of our UT systems in Texas have, then you can create your own login. As a faculty, students can create their own login. As a student, they take a specific privacy security training that gets assigned to them on the workbench, then they can access the data. Some limitations to the data available. Again, the data browser is only aggregate data that still can be used in classes where you are working with undergrad students on what is research, how to formulate questions, and so forth. And then the workbench requires a JIRA. The workbench also requires some data science experience. So depending on which grad student you're working with, they might need an additional help. So currently only R and Python are available for the data analysis on the workbench, because you cannot download data. Basically, you have to do everything on the workbench. SAS will be available in December 2023, but again, there's no SVS and the other easier software that most of our grad students use. So it might be requiring some additional learning on the student side. Again, other than using the website and the data in our teaching and with the students to perform and learn research, there's again resources beyond that. So there's bias specimen, not readily available, but again will be available to researchers if they would like to get work with them. And there is also, again, they will be adding that you actually submit your ancillary study, to collect more information that will come in. I know there's one ancillary study that was added last year about nutrition. That's not something that has started with the program, but they are willing to accept more, again, depending on their funding announcements. So they do have funding opportunities as well, and they do have funding announcements on their website. Again, a lot of data is available. We're showing here some of the graphs that are from the data browser, and particularly in the middle column. So you can get, by age, by gender distribution, by other stuff, and you can look at, again, multiple data. So again, the first picture here in the middle is kind of data about hypertension. The picture in the bottom is about, from lab values of hemoglobin A1C for diabetes, and you can see, the breakdown. This is all available publicly on the data browser. On the workbench, on the other hand, we mentioned that it requires a JIRA agreement, a login, and training. And I'm presenting here a sample of a project that was just finished about mental health and discrimination, where we looked at, again, one of the surveys has 9 questions to assess exposure to discrimination on multiple facets. So we kind of looked at the demographic of the people who answered the survey. We constructed a discrimination score based on the 9 Likert scale question to see, kind of a dose-dependent exposure to discrimination. We also looked at self-reported anxiety, self-reported depression, and how that would correlate with the discrimination score. The graph in the bottom shows here, significant differences between those who reported either currently anxiety or currently depression, self-reported depression, with the total discrimination score that we constructed. Again, we looked also at the correlation between the discrimination score and whether this patient is on prescription medication for anxiety and depression, and the information about the prescription was retrieved from their medical records. So it's not self-reported at this point. It's actually data that are based on their medical records. So again, and then there was correlations, very significant correlation between the discrimination score and if they are on either a medication for anxiety or a medication for depression. Lots of data to be used, lots of genomic data as well. If people are interested to incorporate or work with genomic data in their work, lots of opportunities for our students as well. So I just wanted to bring attention to again, a research opportunity platform for health professionals to be utilized with our students. Thank you.